Hi, my name's Henna and I'm a NICU hospitalist at Seattle Children's Hospital. Thank you for coming to learn about our work. For background, NICU care disparities are well documented and implicit bias likely plays a role here. We hypothesize that social history documentation in NICU notes may perpetuate bias. We aimed to first describe what social factors are commonly documented in NICU notes, second, assess the emotional reactions elicited from reading this documentation, and third, evaluate possible racial disparities in documented content and emotional valencies. To do this, we extracted parent-reported race and free text social commentary from the Hospital Day 15 attending progress notes for all of our 2018 and 19 patients. We identified commonly documented social details and then asked 12 neonatologists to read each history and give their immediate emotional reaction. We retrieved 460 patient notes, and 265 of these included social documentation. Table 2 lists commonly documented categories of social data and compares frequencies across races. Compared to white patients, American Indian and Alaska Native patients more often had any social documentation, and this documentation less frequently included details like parent names or care communication, and more frequently included details like CPS involvement. Figure 3 shows responses to the question, how is your perception of this family influenced by this social history? Proportions of each response, ranging from very negatively in dark red to very positively in dark green, are shown here. Figure 4 shows mean ratings. Both figures suggest a wide variation in interpretation of histories and is skewing toward the negative for all histories, but this is most pronounced for American Indian and Alaska Native patients. Table 3 shows themes we identified from histories rated negatively, neutrally, and positively. Very negatively rated histories often mention CPS, substance use, and potential challenges with parents' emotional coping. These histories also tended to omit personal details, like parent names. Histories describing treatment for substance use tended to be rated somewhat rather than very negatively. Somewhat negative histories also included references to disagreement with the medical team. Neutrally rated histories included other children, interpreter needs, and recent care conferences. And positively rated histories included expressly positive descriptors and more humanizing language. So, to conclude, our study shows that social content documented in NICU progress notes varies widely, and it may differ based on patient race. While readers varied in their interpretations, history skewed towards giving a negative perception of families, most notably for American Indian and Alaska Native patients. Documentation of CPS involvement or substance use was universally interpreted negatively. So social documentation clearly carries potential for perpetuating biases, and thoughtful standardization of it may help counter this and promote health equity.